Our speakers tonight are our own Jeff Cool and I knew I'd Virginia Woolf. How could I forget Virginia Woolf with La Clinica? So first of all, we'll start with Jeff's introduction, and then I will introduce Virginia, and then I will get out of here. Not the club. I'm going to stay for the presentation. Jeff has worked in healthcare philanthropy for the past 12 years the and in the last 10 months at La Clinica as their development director. Jeff and his wife moved to the Rogue Valley in August of 2020 and moved to their home in Phoenix in 21. Between then and now, they've added 3 children. Okay, you ready for this? We've been tracking him. A 4-year-old and two-year-old twins. Double the trouble. And then he said, and I'm not going to let him say this, but I said, okay. Jeff joined Medford Road Rotary in 23 and has not been the greatest of members. He wrote this lately, something that he will be working on this Rotary year. So Jeff, life happens to people. And so I know that we're supposed to put Rotary ahead of self. However, having twins and a new job and a 4-year-old and a wife, I think he's been busy. So we will forgive you because just put him down on the roster coming up down the road for president. So guilt works wonders. Okay, and then Virginia Woolf, who I met, and she is charming. She said Virginia Woolf leads he said Virginia Woolf leads communications for La Cinica, overseeing communication with patients, employees, and the community. She has more than a decade of experience in healthcare marketing and communications, including leadership roles at La Clinica and Medical Eye Center. A Southern Oregon resident since 2006. That wasn't the year you were born. She better not. She's been working too long. Virginia believes in meaningful communication starts with authenticity, curiosity. They use all these big words, and genuine human connection. She is passionate about telling stories that build trust, strengthen communities, and help people feel seen, informed, and connected to care. Outside of work, she enjoys reading, playing tennis, and spending time with her 2 children, family, and friends. Please join me in our Rotary welcome to Jeff Cool and Virginia Woolf.
Hi, thanks everyone for having me. And thank you to Jeff and Claudette for the introduction. We have the PowerPoint presentation. Lovely. Thank you. Oh, I see. All right, I'm going to be doing a little hybrid presentation here with my colleague Jeff. So I'm going to tee it off and talk a little bit about La Clinica, who we are, our history, the community we serve, and our services. And then Jeff's going to take over and talk about serving community need and our projects presently and upcoming. So first and foremost, our mission is, I'm going to read this, so just going to hold on to the mic here. We serve the people who need us most through exceptional, affordable, and compassionate care, inspiring all those we touch to lead full and healthy lives. And our vision as an organization is absolute excellence, open-hearted community, and well-being for all. So we serve the patients who need us most. Primarily, our patients are folks who face barriers to care. We had some numbers on the slide, which you can see our service graphs that Jeff handed out to see our percentage of patients who are Medicaid, who are uninsured, and otherwise facing vulnerabilities to healthcare. So we have a pretty big breadth of services, which I'll talk about briefly, and we'll go on into detail about how they're connected to community need and our projects that are, excuse me, our projects that we are working on. So we provide medical care, we have dental care, behavioral health care, which is essentially integrated behavioral health within our clinics and also our school health centers. We have pharmacy, so we have 2 standalone pharmacy clinics. One is at our Phoenix Health Center, and then the second is a newer community pharmacy on Biddle Road in Medford. We also have education and support. We have within our La Clinica business, the Learning Well, and we offer a variety of education and support there. So we have things from wellness classes like diabetes prevention. We have Zumba classes that are always free to the community. And then we offer education in the sense of leadership development and personal development workshops as well. We also have Winter Spring embedded in the Learning Well, and that is a brief support group. So early roots, we started in 1989 as a small clinic. You can see our photo there of our very first clinic on Houston Street, I believe. Is that right, Jeff? In Phoenix. And we were founded to primarily serve a lot of migrant healthcare workers. Um, we had that tiny little clinic there that was next to the railroad tracks. And fun little story there is that they had to time the procedures according to when the trains ran. They scheduled vasectomies and they had to make sure that that didn't happen because the whole building would shake. So we had grew from 1989 to 2009, eventually having 9 sites, growing to 15,159 patients and 152 full-time employees. We grew into our Phoenix Health Center, which is our large flagship health center on Pacific Highway there in November of 95. Then we integrated dental services in 2000. We started popping up in school health centers from 2001 to 2008. And we started our Happy Smiles program, which is a dental in-school education and service that we provide free of charge to children in the community. And then our Central Point Health Center opened in September 2008, and our Women's Health Center in November 2008 as well. So a lot of growth early on. Then we had some expansion and integration from 2010 to 2019. So that's a photo of our East Medford Dental Clinic there, and that's over on Biddle Road. Growing to 21 sites, almost 25,000 patients, and 338 full-time employees. So we continue to grow in school health centers during this time. We roll out our mobile health center, which is a health center on wheels that goes out to communities to meet folks where they are who have barriers to access to care into our brick and mortar facilities. We've created our Birch Grove Health Center, which is a collaborative in 2014, a larger wellness center, which is another health center location on Biddle, Learning Well, which I spoke about briefly, and our large admin building for the Center for Learning and Innovation, where a lot of our Learning Well opportunities are held as well. Continued growth in 2020 to 2025, we grew 32 sites, 550 plus full-time employees, and over 32,000 patients. So during this time, we launched a large acute care clinic in March 2021, and that really started from community need based during the pandemic. We turned a smaller kind of garage into acute care clinic, and we realized that we definitely saw the need for a larger clinic. So we grew the larger one that you see there on the campus next to the wellness center and our community pharmacy. Continued to grow in school health centers, and then initiated our advanced practitioner residency program, which you'll hear more about with Jeff as well. We are in Ashland at the Opportunities for Housing Resources and Assistance, otherwise known as ORA. And so we have clinicians there who see patients who are in need. We have presence at the SOU. We run their health center there. And so we've kind of spread out throughout the community. Again, our community pharmacy opened in September 2025, and we went further north to and developed the Rogue River Health Center, in September 2025 as well. All right, thank you. I'm going to hand it over to Jeff, and he's going to take it from here.
Thank you, Virginia. All right. Good afternoon, everybody. Again, thank you so much for having us. So to talk about the healthcare gaps in Jackson County, and some of these points are trends that are happening nationally, but we've all seen recent headlines about contraction in our overall health systems, and we're feeling those pressures too. So we have primary care shortages long wait times for appointments. I've been there. I'm sure many of you have been there as well. When you need something done, you want it as soon as you can, and that isn't necessarily happening right now within the healthcare system. Recent closures of primary care clinics really have exacerbated clinic challenges. I will say, I think it's a statistic on the service report of the different insurances or insurance types our patients that we see have. Our commercially insured have never been higher than they are now. And that's just, I think it speaks to some of these primary care clinics, either closures or shortages in providers, where we are seeing more and more folks turn to La Clinica for their medical services. And we're happy to provide those services to the commercially insured, but that's not necessarily our traditional population that we do serve. So that has been certainly a change for us recently. Dental care gap, limited access, high emergency department visits for dental issues. We are one of the dental services that does cover emergency care services at both emergency departments. If somebody comes in with an emergent tooth issue or something happened with their teeth, La Clinica dental or dentists are some of those folks that cover those services. And then pharmacy closures. This one hits close to home since the Rite Aid in Phoenix has closed. Now I think it's been 2 years. There's been a number of pharmacy closures throughout the community. We're seeing it again nationally, and we're doing what we can as an organization to try to fill in the gaps where we can and provide those prescriptions both to our patients and the entire community. And looking at the growth for La Clinica, these are our numbers from just this past year. So children served just over 7,000, houseless patients just under 6,000, and agricultural workers about 1,750. The percentages you see on the slide, those are growth or what we've seen on average growth year after year after year through our work. So we are seeing tremendous growth in these areas, and that speaks to, I think, the amount of people in our community that are in somewhat desperate times, both the houseless, agricultural workers, as well as the children who are here in the community. So one of the programs, very special programs that we get to provide to the community is called Happy Smiles. This is one of I think 2 programs like it. This is one of 2 that provides dental services to children at our elementary schools and middle schools. So we are present in 30 different schools throughout Jackson County. Delivering basic dental education after our big presentation to the classes present for that dental education seminar. Each kid gets a free toothbrush, a floss, similar to what you would get at any cleaning at a dental clinic. And then we invite the kids to be examined by one of our highly trained hygienists. And that hygienist is there to check for overall tooth health, checking for any issues that may need to be referred to their own dentist or potentially our dentists if they do not have dental care already set up. And one of the things that they are also checking for is sealants. So I remember when I was, I think, 6 or 7 or whenever I got my permanent molars, sealants were placed on my teeth. And so you can see that 817 children were served this last year. About 40% of that total, we have placed sealants on those children's teeth, which I think gives a pretty clear picture of the kids that we are seeing through this program probably are not doing the checkups or getting that dental care that many kids who are commercially insured are getting, which really speaks to the need of what we're seeing here in the community. So Happy Smiles is that program. It is one of the programs that is really mission driven. This is not necessarily even a break even proposition for us. This is one of those things that we do because our mission dictates that we need to get out there and give kids access to these services. All right, so just this last year, we opened up our community pharmacy, which doubled our capacity to dispense with prescription medications, not only to our patients, but this is also a community pharmacy. So anybody, regardless if they are a patient of ours or not, can access our pharmacy and pick up their prescription medication. This is really, really helpful for those with, as you might imagine, chronic ailments like diabetes that require constant medication prescriptions and refills. That has been hard to do previous to this pharmaceutical or pharmacy expansion by us and making sure that our patients have adequate access to pharmacy and their prescription drugs that they need to be healthy. So a huge opening for us and our patients and the community. This is a program, so I'm talking about the Advanced Practice Residency Program, which has recently been in the news because it was recently announced, and we heard this news just a couple weeks ago, that through the HR 1 bill that was passed in 2026, one of the provisions out of that bill required states to dispense with what's called a rural health transformation grants. And we have one of the largest in the state that's directly supported the Advanced Practitioner Residency Program. And this is a program in which we take newly graduated nurse practitioners and physician associates. We put them through a year-long residency program. We pay them basically an entry-level salary for what they would see in private practice, and they get their feet wet in taking care of patients. So many of these programs now for nurse practitioners and physician associates, it really is more online based than it is actual, boots on the ground, seeing patients, getting the skills training that they need. So we really see a program like this being extremely important for this community in building the primary care access points that we need. The Rural Health Transformation Grant directly supports expanding this program to our partners at Roe Community Health as well as Siskiyou Health, so that these residents have the opportunity to do rural rotations through clinics like out in Cave Junction, where Siskiyou Health has clinics, Butte Falls, where Roe Community Health does, as well as Eagle Point, so that they're getting some sort of flavor of what that work looks like and how that could be different than what they're seeing here in the Medford metro area. So we have welcomed 6 new residents this past year, and they will be graduating come this October. Many of these residents will end up practicing for La Clinica, and we anticipate many of them will stay in the community and working in other clinics. And we've already seen this play out. One of our residents recently was hired by Southern Oregon Cardiology and their practice. So again, we don't see this just supporting La Clinica. This is really supporting the community's real shortage in primary care access. Oh, thank you. And what the need is moving forward with this program is having the adequate space to house this program and making sure that, if we are expanding the number, to let's say 8 or 10 residents, that we have the space and clinic space, I should say, for them to practice their craft. Right now, the 6 residents are practicing out of the Phoenix Health Center. and they're practicing out of 4 clinic rooms, and that's a pretty tight spot. So one of our upcoming projects. Oh, before I get to that, talk about, or well, I've talked a little bit about this already, but the economic impact on the community and ensuring that there's adequate primary care access. Um, this is really we see as a boon for the local community. Um, uh, Create a living wage healthcare jobs, and not to mention recruitment of the next generation of primary care providers here in the region is really important. We're seeing at least a $60,000 wage threshold, if not above, for these providers. So that provides a real economic stimulus for the community. And then ultimately strengthening our regional stability around the healthcare that's provided here in Jackson County. So some of our upcoming projects or projects that actually have already been completed for 2026. So Virginia talked about the Mobile Health Center and the Mobile Health Program. That's actually kind of how La Clinica started. When we were starting to take care of migrant workers, most of our patients we did not see at that clinic on Houston Street. It was out in the farmland. Getting blood pressure checks, doing the kind of the lab work or medical tests that these folks needed. So that was a mobile unit that was, putting tables and chairs into the back of a van and seeing those migrant workers where they worked. And this is a similar thing where we were providing medical services for those folks who are in need and may not follow or not be able to follow kind of a clinical schedule themselves. If you're houseless, you don't necessarily know what your schedule for the day is, and that's going to prevent you from getting into the medical system itself. So being there, getting them used to treatments, getting the trust and the care that we provide is super important. We are very happy that we have a brand new mobile health unit now out on the streets and taking care of folks where they need help. And that just started in February. And so we're in the process of just getting those rotations back online with our community partners who are seeing a lot of those folks through their own nonprofits. The Teaching Health Center Capital Project. This is a proposed clinic build out in West Medford on Lozier Lane, just south of the Thunderbird. This will be the eventual home for that residency program that I mentioned, as well as all of our workforce development programs that we have. This will be the largest footprint of any of our clinics. It'll be about a 50,000 square foot facility that will have primary care, dental, behavioral health embedded within primary care, as well as pharmacy and basic lab services, and not to mention all the workforce programs. So at full capacity, we should be training around 30 clinicians or healthcare workers out of this clinic each year, which will be, again, a huge boon for the community. Behavioral health workforce programs, this actually will be starting next week. So we will be welcoming 2 what we're calling behavioral health fellows that were newly graduated out of their therapy programs and showing them how we do behavioral health at La Clinica and how we provide basically if something is brought up during a medical appointment, how if a provider is finding out there is either a substance abuse issue, there's grief happening, whatever the behavioral health issue, that behavioral health specialists or therapists can come in and meet them where they are and get them on the track for resources that they need in order to get through what they're going through. All right. And so why giving at La Clinica matters. I mean, this could be, you named the healthcare organization here in the Valley. Giving right now to healthcare without the community buying in, we are not able to expand or do the things that we need to do in order to expand our footprint and take care of the patients that we know are out there, but they're not necessarily getting the care they need at the time they need it, and to the quality that they need it. So we are very happy and grateful to the community in the support that they have shown, and will continue to show as we continue to expand, meeting the needs of our community.